we're here with you and glad that you are able to be with us this morning. And thanks again, and also thanks for your flexibility. We had our plan for yesterday, but due to many commitments, including meetings regarding opening childcare, we weren't able to do it, but we're here with you today. Again, Rachel Burgess-Burnett, Deputy Commissioner. I have with me
Tiffany Junkins, Manager, Children's Services Division.
Victor Santiago, Assistant Director, Children's Services Division.
So good morning again. And so, again, everybody's muted right now, but we do ask that if you need anything, if you need to put it into the chat box, please do so. And then also your questions into the chat box. So let's go ahead and get started this morning. So the agenda, again, is we want to go over and talk a little bit about the city and state timelines. We know you've heard about restoring our economy and reopening childcare. So we will talk a little bit about that today. And then talk to you about how you need to be keeping up with what's going on out there too as well. City and state committees, I'll talk a little bit about what's happening with committee work around reopening childcare. Slot reallocation, I know there's still information that people are looking for regarding that. Then we're going to give you again some important websites and links, and then a few announcements. And we will leave open time at the end for questions and answers as always. So the status update, and again, this is one of those slides that, you know, is always a little grim, but it is what we need to put in front of you just so everybody is keeping up with it, because one of the things that we know in the state of Illinois and nationally is the statistics and what's going on in this arena is what's guiding decisions about what it is that we need to be doing. So as of yesterday, there were positive confirmed cases in Illinois, and this is Illinois data. 87,937. Almost 4,000 deaths were recorded. And then tests performed, the number is up 124,686. The one thing that I will add regarding that is one of the additional markers that the governor and CDPH and IDPH is looking at is positivity rate. And the positivity rate yesterday with these numbers was open it up and make sure. I'm pausing for a second because I'm getting that someone is saying that they are not able to hear. So we're checking technology again. In the chat box. But again, one of the things that I'm talking to you about here is looking at the numbers. And what I was saying at that particular time is one of the things that the governor is looking at is positivity rates. And one of the things we know from yesterday, the positivity rate was at 21.4%. And so what he wants to do or needs to do is get it to 20%. And we're not there yet, we're getting there. But again, there's a lot of information. There's a lot of information that's out there, but I'm asking again, and the websites are going to be up there later, is that everybody continue to do what it says here, is look at it, go to cityofchicago.gov/corona or COVID, and you are able to get in and get maps, and you can see what's going on. You can see what's going on in specific communities. You can see what's going on in the state of Illinois, and you can also see what's going on specific to Chicago. And so again, we want everybody to understand we are all in this together. Here at Children's Services Division, we're trying to monitor and manage the data and looking at it and making sure that we know what's going on so that we can then get information to you and trying to keep you up to date as well. This being one of your vehicles, but what we also want you to do is be going onto different websites and looking for data that you need to be minding to help you think through what's going on in your own community as we're going forward. So the governor has put out his 5-phase plan, and this is the representation of his 5-phase plan. And again, phase 1 was the strict stay-at-home orders that we all had. The social distancing guidelines were put in place, and only essential businesses were to remain open. One of the things that we did do within that particular phase is we did open up what's called emergency child care. IDHS and others worked together to come up with a new licensing strategy so that we were able to say in a child care setting. You could do groups of 10. You could be in a facility, and they were asking at that time that if you think about only 50 people or more, 50 or less being in that building. And so that was phase one. Phase two is flattening the curve, which is what we are hoping to do in Illinois. Non-essential retail stores reopen, curbside pickup and delivery. These kinds of things are now happening. I'm sure if you're listening to the news, you're listening to the governor's conference, always talking about where in Illinois are we able to do these varying activities. But we are beginning to open up some businesses. One of the things that it says here, they want us to wear masks, face coverings, when outside the home, and anytime you're beginning to enjoy activities and things like that, you can start thinking about, being in less than 6 feet away from people and making sure that you're protecting yourself and also protecting others. And so in phase two, we're asking everyone, if you're going into stores, if you've been out there, they're asking you to wear your mask and your coverings before you come in. So again, protect, 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 reduce is what we're constantly talking about across our nation and definitely in Illinois and Chicago. So moving into phase three is manufacturing, offices, retail, barbershops, and others. Salons and others will begin to open. But again, if you look down, it still talks about gatherings of 10 people or fewer, even in phase three. So as we're talking now about what that looks like in childcare, we are trying to mind the guidance is coming from CDC. We're minding the guidance is coming from EDPD and CDPH. There are, lots of discussions. I'm going to talk a little bit about that. But again, phase three, what does that mean? What does that mean for all of us? Then if you're looking at phase four, under the governor's plan, it talks about gatherings of 50 people or fewer are allowed. Again, 50 or fewer, talking about restaurants, bars, and others opening. And if you see there, it says child care and schools reopen under guidance. The guidance is being considered right now, but that's where child care rests, which is in phase four. We could rapidly get to phase four. We could be at phase four in an elongated period of time, and it really is about looking at and being guided by data, looking at it and trying to see what the positivity rates are, and needing those couple of weeks where things are moving in the downward trend. Then phase five is Illinois is restored. This is where we all want to go, but understand we're not going to get there in a rapid pace. We're not going to get there overnight. This is a long-term plan for Illinois as far as restoration. Child care being fully implemented, fully open, within all of the different phases. Phase five is when we would be whole. So I just want everybody to be thinking about it's going to take us some time to get there. But opening child care, if we're in phase four, we get there safely, what might that look like? Mayor Lightfoot has also put in her 5-phase plan, and many of what you see here really does follow what's in the governor's plan, and both have phase one was strict stay at home. Then phase two, stay at home, and then the guidance about making sure that essential workers can go to work. So again, we opened up emergency child care. We also talked about wearing face mask coverings while you're outside your home. Then phase three is stated here, cautiously reopen. Cautiously reopen meaning, are we able to open business based on data? And she has said it as well as the governor. They are following the data. They're following medical advice. They're looking and making decisions based on information that's being shared to make the best decision that they can for residents of Illinois and residents of Chicago. If you see here, cautiously reopening, nonprofits based on the kind of business that they're operating, entities open with demonstrated appropriate protections for their workers and their customers. Workers, customers, again, is looking across the entire city of Chicago, childcare being one of those industries. What does that demonstrated appropriate protections mean? And it really is looking at our industry and trying to see what is it that we need to have as far as all of the protections for children, families, and staff as we start talking about reopening. Phase four, again, gradually resuming business. Additionally, talking about capacity restrictions listed with appropriate safeguards. Again, if we're doing anything more, if we're saying more people in a space, what's the guidance on that? And what kind of implications does that mean for us in our industry? And then phase five, her word is protect. That's what we want, is to protect everyone. What we know is that if we fail to do what it is that we've been doing, and if we fail to do it well, we will find ourselves having more positive cases showing up. That's not what we want. We want to have come through this in a steady, marked system where we're taking our time, thinking it through, making sure that we've had many, many considerations taken into effect before we say, yes, we are ready to go. And so again, I wanted to just put these up there for you so that you know, and I'd ask you to take some time in looking at all of the other wording and every other piece of information that's behind these 5-phase plans, so you understand what's going on both at the state level and also at the city level. And so, as I've mentioned a couple of times, there's a state group of committees that's been pulled together. There's also one out of the mayor's office, and what we're doing across both, and there's state representation on both, there's city representation on both, there's delegate agencies in Chicago represented on both, IDHS represented, DCFS. They're represented in these varying discussions, looking at and trying to decide what kinds of things we need to be taking into consideration. I know some of your concerns that you've raised in previous meetings around group size, and what does that mean? If we're saying, as you saw on one of the slides, we're still talking about group sizes of 10, what does that mean, for example, in your organization and in your site? How might you be able to have smaller groups? How might you be able to space your children when they're in their classrooms? All of those kinds of things are being taken into consideration. Talking about, making sure that you are able to care for your children in your facility and your staff, that you understand and have put in, and we're going to be sending out guidance and all of that after the committees are done, but thinking through what kinds of things you need to have thought completely through in your facility about how do you keep the sanitation and the cleaning done on a consistent basis, more than just in the morning and in the afternoon, having to do more of that. How do you ensure, for example, that when we're talking about children having their meals, and yes, we know our standard of care and child care food programs is about family-style meals. One of the things that, for example, I'm just giving you examples, and I'm not saying that all of these are said and done and written. They will come out. But, for example, one thing that has been stated is looking at how we serve meals. And so instead of family-style meals, making sure that you can do individual plated meals so that you lessen the risk of cross-contamination. And so, again, it's all of those things have to be lifted up, have to be discussed. So at the state of Illinois, there's, as you can see, there's representation of different committees looking and diving into pieces of the work and thinking about what kinds of things we need to have thought through, and some of those I've mentioned. But then how do you, the second to the last and the last, is how do you put all of these systems together? Illinois has a lot of different systems. How do you pull all of them together so that they can all be aligned, and then you can get policy and fiscal decisions made once you can say who's going to be able to do X in the state of Illinois that's going to allow us to safely open child care, be able to have policies that we can then use as our guideposts for how we operate our programs, that talks to us about the number of children we can have in care. Fiscal implications, for example, as you know, you have Head Start funding. We have to go back to the federal government, talk to them about what Illinois is talking about, and making sure that they're fully aware that in the state of Illinois, we're talking about group sizes of 10, perhaps. What does that mean for how you operate your programs? And so, again, there's a lot more communications and work, and believe me, it is fast-paced. Everybody's trying to consider the different things that we need to. Again, in the chat box, again, I encourage people to put down anything that you think that we need to have thought through, that you want us to list, because again, as we're going through this and trying to make sure that we get all things covered, again, we want to make sure that we're not missing anything. This is about health, this is about safety, and this is about minimizing risk once we're able to open up the child care program. At the mayor's office, again, as I mentioned, started that work group. It is, again, cross-represented. Today, we had at the mayor's meeting, we also had state representation. At the state meeting, there's mayor's office representation as well. And so it's just trying to have it cross all of these so that it's not being done in one house. It is being done system-wide, it's being done statewide, and it is being done at the levels that are required in order for us to have the policy and guidance that we need to safely reopen. So I'm going to turn it over, and I'm going to let Tiffany talk to you about slot reallocation. Just wanted to give you some of the reminders on how we got to where we are as far as thinking about slot reallocation, but I'm going to turn it over and let Tiffany talk to you about it.
So good morning, everyone, and thank you for joining us today. Just wanted to go over, just kind of recapping where we've been and where we're going as it relates to slot reallocation. So back in November of last year, we did meet with our delegate stakeholders at the King Center to talk about which way we wanted to set our priorities. And what came out of that, those working sessions, were that we were to focus on community needs being one, and then also subpopulations being the second. And so in thinking about that, those are some of the things that we're definitely holding to the forefront. Just to kind of move it forward to 2020, we have been in consultation with the law department, as mentioned before, and we did get the approval in March to go ahead and move the work forward in terms of being able to allocate the slots that were relinquished, and also slot movement. So we wind up finalizing our slot reallocation guidance and getting it out to you in March. During that time frame, of course, we've had center closures, and so we've had some things kind of slow the speed, so to speak, of where we're going with this. But I do want to let you know that we have been working individually with delegates and making decisions on the agency by agency basis as it relates to your request. Just wanted to go ahead and throw in the reminder that we had 340 Head Start slots from the Archdiocese closing. And so those are, you know, probably where we have the plethora, I guess, so to speak, of slots. I can tell you now that even with the applications that we've received, we still haven't had the demand that we're looking for to fill those slots. So I guess I want to make sure that you're aware that Head Start slots are something that is still in rotation. I know that this is something that is sensitive considering the time that we're in. And I just want to let you know that, you know, if Head Start is something that you're looking more to do, more to serve of in your various communities, to make sure that you're completing that slot reallocation application. For those who are still waiting on us to give a response, just know that we will be reaching out to you, and feel free to go ahead and send myself and Victor an email if need be. We're willing to go ahead and set up Teams meetings to go ahead and discuss what your request is. I'm trying to get through slot movement first within your own organization. And as much as we can go ahead and talk about that plan to go ahead and get those additional slots out, I really need you to understand that we're taking your considerations of community need and subpopulations to be a part of our decision-making there. There aren't enough PFA and PI slots, and I think that, you know, a lot of people have kind of submitted that that's what they want. I just want you to know that there isn't, and so a lot of people are going to get the no as opposed to the yes that they're looking for. And so I just wanted to give you a heads up with that. Don't want it to be a secret, but that's the, you know, that's the way that we're going. So make sure if you have any questions for me, feel free to leave it in the chat or just send me an email, because I try to be very responsive in terms of email. All right, thank you.
So just want to give you an update. We have been moving forward with putting together the next application for that goes up on our website. We have a anticipated launch date of May 21, anticipated launch date of May 21 for our application launch. And this was just updated as far as an anticipation. So just letting you know that that's an anticipated date. We're hoping that there's nothing else that comes up, but right now, just to give you a heads up, and for you at your site, remember, you know, doing your slot matrix, making sure that you understand who your returning children are, making sure that you thought about those children that are transitioning from 0 to 3 into 3 to 5. You need to be working on all of that, because again, once this launches, we will have an elongated period of time that it will be open instead of just a few weeks. But even with that said, once we are putting it out there, parents are going to begin to start making their recommendations on where they want to go. What I am going to advise you, and we will let you know as soon as it's up and live, we want you to go in and we want you to go to the site. We want you to see what your parents will see when they're going into the site, as far as seeing the different selections for programs and what they're actually going to be going into as parents. staff at your site that help parents, make sure that they go into the site once it's live so that they can see what parents see, so they will be able to talk to parents about the site as well. So saying that to give you an update, this is a tentative date, it's anticipated. If it changes, we'll let you know. If not, what you're going to do is get an announcement that it is live May 21, and that's our goal right now. So just wanted to give you an update on that.
Thank you, Cerebral.
So one of the next things that's coming up, and you should have gotten your applications. I know in our last meeting, that was one of the questions about your grant application. Since our last webinar, those applications should be out there in your hands. If you have questions about what you have, there's a list of individuals in here that you need to contact about the grant application, the COLA grant application. Today is May 15th. Just want to remind you the grantee application is due today. We will meet our deadline of submitting the grant application that we've been approved to submit, which is a different methodology. It's the grantee application. We will be getting information from you that will be submitted at a later date. But what we want you to understand is our deadline for getting our application is today, and we are meeting that deadline. If you have questions specifically about the grant package that you've received, the names and email addresses for those individuals are right here for you, so that you can go in and get your questions answered. Anything you want to add, Tiffany?
No, you know, I think that people have been doing a pretty good job of reaching out thus far. And so, as Rachel had mentioned, you know, that this information is coming to you. And the good thing is that we're not rushing you through the application process this year. So we do have an opportunity and a little flexibility that we've been given with the federal government to make sure that understanding kind of the time that we're in, that we can have a little bit longer to get that information. At the same time, just thinking about kind of your internal processes for getting those approvals and things like that, and making sure that your bylaws are up to date and going to reflect, you know, things like electronic approval, telephone approvals, and making sure that your documentation is going to represent, you know, the steps that you've taken to get there. It's going to be vitally important. And just remember, right, this COLA application, it also includes quality money as well, quality improvement dollars. Someone asked me a question, I want to say yesterday, and Andy, thank you for asking the question, but it was, you know, one, does this kind of represent or affect all of our grants? You know, sometimes we refer to Head Start, and we don't necessarily go through all of the different types of programs that it includes. So when we say federal Head Start, we are referring to Head Start. We are referring to Early Head Start. We're referring to Early Head Start Child Care Partnership, and we're also referring to Early Head Start Expansion. And so if you have any of those funding streams and funding sources, then it is applicable across the board to all of those. And so it's important for you to know that it affects all of those federal funding sources that we traditionally would just earmark and say federal Head Start.
Thanks, Tiffany. So again, just making sure that you have active links for some of the information that have come out from the Office of Head Start, supporting food insecurity for families. We know that many of our families are really suffering out there. These are families that we serve, and I want to just take a second and say thank all of you, those of you who've been able to really find access to resources, and what you're doing for families. We can't say enough about making sure that families are accessing food pantries, making sure that families are accessing and being given access to, accessing a few dollars to help them do the things that they need to do to help them get through this. We understand the families that we serve really are those with the lowest resources. And so, you know, I thank you for using the dollars in your house. I thank you because I know many of you have done some additional fundraising and gotten additional dollars to do additional supports for families. All I can say is thank you, thank you, thank you for everything that you're doing for our families and your staff out there. Caring for children in group settings is a follow-up conversation. There was a webinar. You can go onto the website. You can view the webinar and see what kinds of things they're talking about. Caring for children in group settings. during COVID-19, but then there was a follow-up conversation that you can also, from this link, get into and hear what other people were talking about as far as the working group care. COVID-19 check-in, again, this is one that's on the website. This is Dr. Bergeron, who actually did a webinar where she just wanted to do a COVID-19 check-in. And again, her thanking those of you who are out there, what you're doing, and also her just saying a few things that she hopes are happening for children and families while they're at their stay-at-home orders. And then lastly, partnering with families to improve their economic stability during and after COVID-19. And again, this link just gives you a list of all the different kinds of funding opportunities and things that are out there for families. And so as we're working with them, making sure that they have access to understand that there are some things that because of what they're going through, that they can get some additional resources. For example, we have parents who are not working right now. Some of them are eligible for what's called pandemic unemployment. And under normal circumstances, maybe they would not have been eligible for it, but because of these circumstances, they are, which again is resources into that parent's household. My caveats to that, of course, and you've all heard how difficult it is for everybody to go through the unemployment system to get their applications through. But if they make it through, having those resources in their homes can make a difference for those children and those families. And so, again, just wanting to make sure that we are making sure parents can access different resources. The SNAP benefit, for example, if children were eligible for free or reduced meals within a school system, it makes a parent eligible for SNAP so that she can then have some additional resources coming into her house. And I'm just going to use this one as a caveat. I have 5 grandsons, and I say to my daughters constantly, I don't know how you feed them. I know what it took for me to try to feed them the few days that I have them, and it's right now, children who are home all day, it is making a difference in what parents are able to afford as far as being able to feed their family. So accessing these additional support services really has been helpful for parents who've been able to access it. So I just encourage us to continue to let parents know that there's some help out there. Again, I thank you for all the help that you're doing. Just want to make sure that we're also making sure that we're giving our parents as much information as we possibly can as well. So there's some websites and links, and I put these up. These are some from before. Just want to make sure that we're accessing them. That, again, we want you to go to EDPD and then look down the list, and it says Community Organization Guidance. This is being updated, but there's information on there to think about what do you need to do in your specific industry, childcare being one. There's some guidance there. cityofchicago.gov/COVID. You can go on and you can get the same kind of data that I shared with you, but you also are able to get Chicago data on COVID-19, meaning testing, meaning number of positive cases. Those kinds of things are drilled down to Chicago data. The latest coronavirus update from the Office of Head Start. There's constantly updates that's coming up on the website. You don't have to be a Head Start funded agency to go to eClick. There's plenty of information there. I encourage everybody to click on it just to get some additional information. And then there's the Governor's Office of Early Childhood Development, of course, where there's also information there regarding COVID-19. And also another one of the websites that everybody should continue to look at, because again, one of the things that the governor put into his budget was an increased allocation for the Early Childhood Block Grant. Those kinds of things are also, once they go through legislature, once they've been voted upon, that kind of acknowledgement ends up on that exact same website. So again, I'm just wanting you to think about the other places that you can go, getting resources, and thinking about all the things that you need to either be saying to your own staff or to your community of parents or just your community as well. Many of you are really, as we talked about before, the hub in the community, and people are coming to you for guidance, information, and so we're just trying to arm you with some information that you'll be able to share when you are being asked questions about COVID-19, and again, as we're moving forward with post-COVID-19. I left this slide in. This slide was there from last time, but I left it in again because delegates, you have to actively work and engage your parents. Again, and I'm just going to say this, what we were able to do, and I think Head Start all the way up to Dr. Bergeron for the flexibility that we have to be able to continue to pay our delegates through COVID-19. That flexibility, as stated right now, is through June 30th. If anything changes, we will know, and I will let you know. But right now, through June 30th, the flexibility exists. With that said, we're able to have our staff be paid in community at your organizations, and there is a requirement. That requirement is that you are communicating with your parents. This is vitally important for two reasons. Number one, we just want to know how our parents are. But number two, you want to know how your parents are, because once we get on the other side of COVID-19, whether we're opening up with, minimum numbers or whatever we're doing, you need to be in touch with your parents to understand if they feel safe coming back. What kind of communications are you having with your parents? Are you having meetings? Are you having discussions? What are you doing? We'll give you some information to help with that, but parents need to feel that what we're doing on our side is putting in place systems that's going to keep their children safe. They've heard a lot about COVID-19. Some of them, it's been touched within their families. They've been harmed. We want to know when they get ready to say we're opening, that they have had information that gives them a level of safety and thought that we have thought through all the things we need to do within child care sites to keep them and their children safe, to keep the staff safe, and to follow guidance in order to make sure that these are healthy environments going forward. It also asks that you put your notes in family case notes. Again, we are not, and we got a notification that we don't have to do a PIR. That does not mean that we will not be required to give information reports about what's happened over this period of time. So I need you to still be putting your information on what you're doing, your contacts with families, have your staff still go in and put those family case notes in so that we can have the documentation to talk about the kinds of things that's been happening with and for families and community. You've got to be responsive to your families. You've been doing it. I can't thank you enough, but we want you to continue to do this through this period and through this process. One of the reasons that both the federal and the state said yes could continue to pay, this is one of those reasons. They wanted us to still be able to work with our families and try to help them meet their needs. And we understand they're not on shelves. Many of the things that our families need, diapers are, the shelves you go through, and some of them are virtually there. And so some of them are coming to you and asking for help with diapers and wipes, and we know that. And so again, I thank you. But these are the kinds of things that help families make it through, reduces a little bit of their stress, helps them also stay connected to you. You've got to communicate with us on a weekly basis, and I thank you. I've been receiving them. They're going to the supervisors. I want you to know that those are then coming up to me so that I can see the kinds of things that you're doing. And I can't stop boasting enough about what our delegates are doing in Chicago with and for families. And so I thank you. Let's just continue the work, and we will continue to do everything that we can, and then making sure that whatever flexibilities we've been given for payment, it's our plan to continue to do that with and for you. So the next webinar date, we do have another one in a couple of weeks, and then another one on June 11th. So please put those dates on your calendar. And it's my understanding that the launch went out last night, and I hope that you've received it. This has to do with the CARES Act funding. We need to get information on how many agencies or who have actually accessed the CARES Act funding. Again, those were federal dollars. Remember that we are paying you through the federal fund as well. You were eligible, if you chose to do so, to apply for the CARES Act funding, and that CARES Act funding was for payroll protection program. And so if you applied for it, you had a certain amount of time by which you needed to expend those dollars in order for that loan, because it was a loan, in order for that loan to be forgiven. So we know that some of that timing, because of you're actually applying for CARES Act, being awarded, some of that crosses directly over what it is that we're doing for you as far as funding your organization as well. We have to be able to capture that information for those reasons. And so that survey is out there. There's it's not like 20 questions, it's only a few questions, but we do need you to respond to that. And I had said by today, I will look to see how many of those we get, because we really do need to have it in so that we can sit down and summarize responses. And so I'm encouraging everyone to go ahead and finish your survey with those questions that are in there, getting that back to us so that we can do a summary of what we know has been accessed through the CARES Act through our delegates. And so on the launch of it, it's Monday. Thank you, Tiffany. So Monday the 18th is what we're asking for, and not the 15th. That was just me wanting to be hopeful. Today is the 15th. Okay, that was an overreach.
But don't procrastinate, don't procrastinate. If you can do it today, we want that today. We want that information as soon as possible, but at the latest on Monday. Absolutely. Thank you.
So I just want to take a moment right now, and again, here's one of the websites for you to go to, but what I want to do now is summarize some of the things that we've just talked about, and then we can go and do some questions and answers. Again, I just want to remind everybody that at the state level and city level, there is conversation going on as we speak to try to think about what would it look like for child care to open in the city of Chicago and state of Illinois. What kinds of implications does that mean? What do you need in order to provide safety? Previously, one of the first things I did on the first webinar that we did in COVID was say to you to start thinking about your policies and procedures. It is imperative that you think about your policies and procedures that are implicated by your reopening your facilities, that you're thinking about what you need to add to your parent handbook so parents understand what it is you're saying to them. If you are changing anything, you got to let the people know what you've changed, and you got to give them an opportunity to read it. My recommendation for everyone is that you have a signature page, both in any update in your parent handbook and any update in your personnel policies, that individuals who are receiving it are signing off, acknowledging that they've received these documents from you. And so if there's a question later, you can go back and say, on this date, we issued this handbook, we issued these notifications so that you are fully aware of what it is that's needed in order for you to actively participate in our program. Remember, this is about health, this is about safety, and this really is about our ability to remain open. And I say that in all sincerity. What we want to be able to do is open up our child care facilities at whatever level initially, and then as we expand. But we need them to be the healthiest and safe environments that we possibly can. But that reminder that we are still in COVID-19 here in Illinois. We have not passed where we are not having active cases in Illinois. And so we will have to have all kinds of policies and procedures that everybody will need to be following in order to keep themselves healthy and safe. Parents need to understand what that means for them. Yes, we know if there's a sick child, you would have that parent pick up that child. What notifications are you going to get back on what happened with that baby before that baby can come back? It's all of those acknowledgments that you currently have in place that may need to be strengthened because of the impact of COVID-19. These are the kinds of things that are constructively being talked about in these committee groups, and what kinds of detailed information we can give back. There's CDC guidance that everyone's looking at other states that have begun to open to see what kinds of things are working and taking some of that information. Again, on your behalf, I just want you to know that there's groups of individuals from the state level government, a governor's office, IDHS, DCFS, and I can give you all of the S's out there. But we're all working because we understand your concern. But we also want you to understand this from all of us. We are also concerned. We want to make sure that when we say open, if we're saying to the governor, for example, child care can open in the state of Illinois, that we've really thought through all of those implications. The meetings have been happening. It has been a whirlwind of meetings consistently that have been happening. Some of you, I hope, that are on the call right now have been on those calls that I know I have joined and thinking through all of this. So the voices are being heard. Policies and procedures are going to be written. A lot of this is going to pass through IDPH and CDPH before it actually hits the ground to make sure that everything that we need to be thinking about with health concerns, those considerations are taken as well. I do know that there's concerns about getting PPE and all of those other things, and those kinds of things have been lifted up to the state as well. And believe me, they've been lifted here at the city level. And we are also, and I have no confirmation that I'm getting it today, but I will say that we have listed it as something that we also need to do on your behalf. And so just wanting you to know that we are working behind the scenes, and right now everything's behind the scenes because we can't see any of you. And I miss seeing all of you. You know, I'm just standing up, and I'm imagining myself right now at the King Center looking at faces and seeing people, and it's been a while since we've been able to do that. So believe me, all of us are suffering through just missing and having to talk through devices, different world that we're living in. But with all of that said, I just want you to understand that we are doing everything that we can to think through how might we be able to do this? Because this is about safety, this is about health, this is about making sure that parents can come in feeling that we have thought about how do we keep their children safe. That skittishness is going to be out there about bringing children into group care. We acknowledge that. So with that said, we understand that when we first opened, 100% of our children coming back would be something that we would wish for, but I'm not going to think that that's going to happen. We will have some parents that will come back when you initially open up your door, and there's going to be some parents who are going to say, I can stay home a little bit longer, or I have somebody else who's going to be taking care of my child. So I do encourage you right now, as you heard today, we're beginning to talk about reopening child care at whichever staging and at whichever level. I encourage you to do, and I know some of you are already doing it, survey your parents, survey your staff, find out where they are so that you have some gauge for what it might look like when you begin to reopen your doors. And again, what you do on your side, how you welcome parents back, how you make them feel safe in your environment really is going to make all the world of difference for them. Lastly, what we are hearing, and all of us are hearing about it, and we are asking for more detailed information, and this virus, something changes consistently. And so we do know that in children right now that there are cases of what is being confirmed and being called something very similar to Kawasaki disease. So know that that's a part of what's being discussed and asking for guidance from CDC and others, because we're talking about opening up child care, we're talking about school-age programs, we're talking about summer programs. And so understanding what that is, what it looks like, so that we can have that kind of information in our hands as well. Again, things are constantly changing, things are constantly shifting, but what I want you to know is we are doing everything that we can because our concern is about you, our concern is about your safety, and our concern is about your ability to open and remain open. So with that, I'm going to go ahead and we can open up and see what kinds of questions we have up here. Someone asked, will we send the presentation out? We will make the presentation available, absolutely. The committees, the question about who's on the committee chair, the state has different assigned. I can give you names. I don't have that with me, Scott. But across those committees and at the city level and at the state level, there are individuals that are leading the conversation. But there are, everyone has had, through those committees, the ability to chime in and talk about what's going on. And so I can give you who's identified as those who are really moderating conversations as we're having them. I can send that out to you. Yes, about the lack of ability to find, and we know that we're hearing it consistently. Maria, thanks for putting that in there. I know that many people are trying to get PPE, and you're finding that you can't because, again, it's being shipped to larger organizations and hospitals and those places. And so we're trying to figure out how we might be able to get some, being the city of Chicago, that we can distribute because we understand what you're going through. And listed in the committee work as well is the need for this before we can get these doors open. So the state of Illinois is also looking into how do we get access to those for you. I think that one's talking about group sizes, about what's floating around. And so Rachel has already mentioned kind of, what's floating around is 10, but even saying that, I know Rachel and we've had discussions about, 10 still requires that you need 2 teachers in the room, right? And so that actually makes then a group of 12. And so at the state level, when we're talking in city, that's exactly how we talked about it, thanks Tiffany, is that we're talking about 10 children in a group. We know that those are older groups because you don't have 10 infants in a room. Early Head Start and others are not allowing us to do some of that. But what we are looking at is if we started off and we said 10, you want 2 adults, you want to minimize risk and minimize the number of people that are coming in contact with children. And so that's what's floating around as far as numbers right now. And again, that's for the start, but that's not the finish. And so just understand these are some of the discussions about how do we stay and determinants about how long we will stay at any one level really is based on what's going on around us and in our community being impacted by COVID-19 as we move forward.
The question is, are there any precautions for our home daycares, so our family child care homes?
Yes, and the discussions about family child care homes is a part of what's in here, even talking about home visits. Across all of the varying models and where we're touching and interacting with families, all of those are being discussed so that we can give some guidance. Right now for emergency child care right now, you can have a group of 6. But what we're talking about later, again, the guidance is happening now. Those discussions are happening right now. They are reaching out to find out from other individuals and going back to figure out exactly what kinds of discussions were being had about family child care homes to make sure that we're not missing that kind of information and that it's included in these conversations.
Someone wanted to know, how do we connect with the working groups that were mentioned? Your resource to the working groups is our Deputy Commissioner, Rachel Burgess-Burnett. And so if you have anything that you would like to contribute, some ideas that you want to go ahead and float, you float them through her because she's going to be the representative for you at the various levels. Tracy, you're asking,
Tracy, and I know that you raised this one previously, whether or not, or you or someone else, about our being able to have work between the number of children in care and those that are not in the building. Can we continue to do work remotely with them? Those are some kinds of things that we're talking about, and for that one, that's the conversation I'm really having with our federal funder, because right now they're counting it as we do this, but I want to make sure that as we move forward, that I'm not giving you the wrong advice. And so in concert with what we're doing city and state, I'm also engaging conversations with our region to say, if we're saying only 10 in a group, can they consider counting children that they're not in the building, that they're doing this remote work with? I don't have an answer for you, but know that it's been lifted.
There's a question about, will providers be paid for PFA and PI for July 2020 to June 2021? That's what we anticipate. I mean, we don't know what the future holds, and so we want to be honest with you at this point. We haven't received anything that would make us think any differently, so I can't give you a definitive, but that is the plan. But when we hear something, we'll definitely let you guys know and give you an update regarding funding.
Right. As I mentioned, guidance for home visiting is a part of the discussions as well. I just saw that one on there, so that's being discussed as we go through this.
Somebody asked, is COLA just for Head Start and Early Head Start? And so as I stated, COLA is for Head Start, Early Head Start Child Care Partnership, Early Head Start expansion as well. It's not for the PFA and PI funded programs. The COLA funding that's provided to us is from our federal funding source. And so when we refer to federal Head Start, we're referring to those plethora of programs that fall under the federal funding. And so it's applicable to those federal funding sources.
Go back down for the other one.
Which one?
The one right.
This one?
Question about Copa super users and all of that. When there's a question about Copa, what we'll do is we'll take any question regarding the Copa system and we'll pull that into the team that can respond on that question, Sharon. I don't want to go over it. I just want you to know that we'll get back to you on anything related to Copa.
Somebody's talking about, hey, Scott, you're talking about the purposes for the quality improvement dollar. So we're happy that you've, taken a look at the materials that were sent out. And so, yes, an emphasis on trauma-informed care. That is one of the ways that the Office of Head Start is asking us, and we're asking you to think about the things that you can do around trauma-informed. There's some other caveats to how the funding can be used, but that is a big call out, especially amongst the times that we're in now. Will there be training provided on trauma-informed care?
As we move forward as a grantee and start thinking about all of these things, and trauma-informed care is one of those that, of course, Scott, has been listed in many, many different arenas. It is one that we've had discussions about here as a grantee, and the kinds of things that we might be able to do, so know that that one's been lifted up. And based on where we go forward with certain support services and what we're able to do, it is a conversation that's being had here at the grantee level. We know also that it's being had at the state level, so it's not lost on us that this is one of those that we need to have some concern for, consideration for. But to Tiffany's point, we also want our delegates to think about on the ground where you are with your families and children, what within your practices might you be able to acknowledge and do as well.
There's a question about the quality improvement dollars. Are they one time? So yay, let's go ahead and clap it up. Woo, 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 woo. They are actually not one time, right? And so that's good, right? They're going to actually be built in your base. So the COLA and also the quality money will be used to actually be that increase that you'll get over then the next funding year as well.
And so the great part about that is if you are doing something different that you decided to do with those quality dollars, because those dollars are going to be built into your base grant, you'll be able to continue with those programs and or services.
Will our programs not be able to reopen until phase 4? And that's what, the revitalization phase, I believe?
Right now, what we're talking about is getting to phase 4 where, and we could get to phase 4 fairly quickly if we can keep the numbers and the positivity rates down. That's what's built in, is looking at phase 4 where we can start reopening what we believe is safely with childcare. But again, it's based on data, it's based on information. But right now, what we're saying to everybody is start your work on your side of thinking about it. I know many of you have already started having discussions about what this might look like. And then what we're going to be able to give you is your guidance that comes from the state and also from the city to help you in your discussion. But looking at both of these models, what you're looking at is phase 4 is really where it's a safer place to start opening childcare. Part of that, again, is the intimacy of childcare. And we chuckled on one of our calls where we're talking about staying 6 feet apart. You can't diaper a baby 6 feet away. And so in our industry, we have to get close and personal with our children. And so really thinking this through is what we're trying to do, so that when we do say we can open, even with smaller numbers, there's just things that we can't do in separating a teacher from a child. And so it's thinking through all of that that's happening. And so it being in phase 4, it's really a better place because it gives us the time that we need right now.
Yeah, and leading into that, Farah, you also mentioned about if we're not able to open by the end of June, will we continue to be funded? I think that question has already been kind of raised, and we've kind of talked about it. We would like to continue to fund, right? But obviously we need to also wait and see what the governor's saying, what our federal funding sources is saying. And so as soon as we get more information from them, we'll let you know. We do intend on being able to have you guys billed at least through June 30th, which is great. And anything after that, we'll go ahead and keep you updated.
So another one is families indicate they or someone in their immediate family test positive for COVID-19. Should this be documented? Let me say, for confidentiality's sake, there's things that you're going to put in the data system and things that you won't. You might be able to put that in, leaving off personal identifying information. But we will let you know how you will be communicating these different things. and then what the response is and what do you need to do at your facility. And again, it's based on whether or not it's a child in your center, if it's a parent of a child who hasn't come to your center, all of those things will be taken into consideration. And yes, we will give you guidance on how do you communicate that to us, and also the other guidance on whom else you have to communicate with.
The next question has to do with child care centers that have completely shut down. And if their staff is not working remotely, will those centers be required to return any reimbursement dollars they have received? So interesting question, Scott, that you posed. I think one of the things is I need all of you guys to be able to make an assessment with the agencies that you have, right? Those centers. Let us know. I mean, we're expecting that unless somebody has notified us that they're closed and that they're not remote learning, we expect for centers to be actually open. And knowing that we have the flexibility from our funders and being able to actually pay staff, we want to make sure that we're doing our part, kicking into the economy to ensure that workers are still getting paid, right? And when they're getting paid, even though services are not the way they used to be, they're diminished, we still want them to be doing something, right, in order to receive the funds that they're receiving. So if this is an issue and you know of it, definitely let us know, because we need to know if folks are not actually following through then with remote learning. We need to know if they're just completely shut down and aren't doing any practices such as parent outreach and things like that. We don't know what we don't know, and so we need your help in letting us know.
You already went over that.
Okay. Somebody had asked, are the COLA applications from the delegates due today? No. So the delegate packages are not due today. Under normal circumstances, had COVID-19 not happened, today would have been the due date for the delegate. Well, actually, probably earlier in the week would have been your due date. Our due date still would have been May the 15th. So at this point, thank you for the flexibility that our funding is allowing us to go ahead and submit a grantee application that includes the amounts to the delegate agencies, and then we're going to be able to do our delegate applications later, okay? And so we do have that flexibility, and that's a great thing, right? They're really working with us and trying to understand that we're operating differently, our ability to do outreach and things like that, and to be able to kind of connect with the people who we need to connect with. Things have changed, and so we're operating differently. We have been given more time, and so we appreciate that. And all we have to do today is submit the grantee application, and we're going to follow up with you guys to let you know when we're going to need your applications. But it's not due today, thank goodness.
So the question, Brenda, about the survey, whether or not it's just for Head Start, no, it is not. It's for all of our funded programs. If you actually applied for, and the question is, well, did you apply? And if the answer is yes, then we're asking you for some information. That is for all of our funded programs, both state and federal.
Cindy, it's a lot in your message. I want to say, if we have not fully answered your question, go ahead and send an email to me, Madeline, and Glenn, or our COLA email address, and we will get back with you if something has been left unanswered. But I think most of the things that you wrote are already covered. Somebody wants to know if child care centers should wait on DFSS to provide health and safety guidelines. We want you to be able to make assessments within your own organization, right? What we're going to go ahead and provide to you is going to be kind of guidance to help you get there, but don't wait on us. We want you to already be able to make these assessments within your own programs. And then, the guidance that we're going to provide, that'll be a help, hopefully, to you. But we don't want you to sit back and wait, right? We want planning to be occurring. We want you guys to be thinking about the different strategies. If you need a thought partner or anything like that, you want to run something by us, please do. But don't wait. Be planful. There's a lot of questions about PPE. I just wanted to let you know, and so Rachel has already mentioned, we're trying to see what we can do at the City of Chicago level to help you with getting PPE. You know, nothing is set in stone at this point, but we are working on a strategy to try and help ease some of the burden.
And to your question, Scott, yes, the committees have already raised the issue of PPE and the lack of ability for people to get it as one of those that is going back to the governor and also to the city regarding our ability to open safely. Will child care opening be based on the governor's phases? It will be based on a combination of the two. Like I said earlier, Zuli, in our conversations, it's the state talking and the city, and now they're talking together to try to come up with a plan of action for child care in the state. One of the things that I want everybody to understand, different communities and different sectors of Illinois are seeing different heightened issues with COVID-19, Chicago being one that's really impacted. And so the city of Chicago, you might see something that says in a southern county in Illinois that they're able to do something with child care that we are not able to do with the city of Chicago because of our numbers. So again, just keep your eye on what's going on. And right now the governor is looking at various counties to determine what they might be able to do, and some of them might do it before others. But I do want you to know that for the city of Chicago, yes, we're looking at the state guidance. We're also looking at what's going on in the city of Chicago. They're going to be talking to each other to make sure that whatever guidance comes out, that it really does represent what's happening in the city of Chicago based on the data, based on the information, and based on the impact here. The question about waivers for meal service. Yes, again, it was important as we were pulling these committees together that ISBE be a part of the conversation as well, because ISBE is where the food contract comes from. And the guidance that the CDC is giving, ISBE is looking at that and trying to make some decisions about congregate meals. One of the things that we have been doing, again, is family style, but the recommendations that are coming back are talking about not being able to do that. What we're saying then in this instance is making sure that they're aware of this guidance, and so if they needed to come and do an inspection at your site and they don't see family style, you would have been given guidance that allowed you to do that. And that's what we're trying to do, is think through all of these places where we can make sure that you're protected from licensing, ISBE, and all of those.
Megan, you wanted to know if a group size of 10, do we have to have a Pell teacher with both groups? And so this is things, again, we're discussing. I appreciate you for raising the question. We haven't worked through all the specifics. So that's something that we'll definitely note, and we'll get back to everyone regarding that later.
Yes, and I will say yes, if you look and you layer between the two, you will see phase 2, phase 3, phase 4. Remember, phase 2 was emergency child care, where we were able to open up emergency child care in phase 2. And that's what we're still doing. Right now, as we move into phase 3, emergency child care is still written into that. But now we're looking at, if we begin to phase in child care, what might it look like? And so that's why you see some overlap, and it may look and seem a little conflicting. But I just want to remind you that there is child care that's open right now in the state of Illinois under a new executive order with a new executive licensing standard that is allowing them to do that. And so that's where we are when you're seeing phase 2. You're absolutely right. Yes, there's child care. I'm not talking about you, and I'm not talking about your setting unless you're doing it under emergency care. But what we're talking about is getting back to a standard of care for a much larger group of families that would be coming into our facilities, and you're going back to your licensing standards that predated emergency care, for example, and with that standard having been thought through with all of the new guidance that needs to be in there for opening child care in Illinois.
Toy, you have a question about, is there a template or a suggested guide to surveying our families? So there isn't, right? There really isn't. I think that, surveying your families are going to be unique to your program and the community that you're in and the parents' needs, that you know about. And so there isn't. But if you do need a thought partner around this, feel free to reach out to our staff, right? We have supervisors who are here to help. We have other staff who are here to help. And so we'd be more than happy to go ahead and kind of help you think through some of the processes in terms of surveying.
So if we're not able to do it, Scott, we'd be talking to you about how you'd be able to use your allocated resources to get PPE. But right now, let us move through this first layer and see what we're able to do. And then if we're not, then we will come back to all of our delegates and talk a little bit more about accessing PPE.
Yeah, absolutely.
And yes, go ahead. Yes, we're talking about mental health support. We're talking about it, for example, at the state level, and how do we integrate some of what we know is happening at the state level that they're already doing? How do we get some of that across the state? How do we have consultants, many more of them, and how do we then have information that we can give to all of you? We understand the mental health and support for both families, but I also want to throw in there for your staff as well, because they are also suffering through this as well, having been touched by COVID possibly. And so their mental health and their social emotional levels are just as key and important here as we think about it. And yes, those kinds of things are being talked about within our committee work.
And in addition to that, Rachel's absolutely right. I know that we've talked to delegate agencies who thought perhaps maybe their non-personnel portion of the funding that they have was going to be underspent. And so trying to help agencies think about, right, reframing and refocusing some of those dollars and repurposing them to go to things that truly do, at this point, are going to be heightened. Maybe you didn't plan on when you originally submitted that budget, but now as a parent, mental health is one of those areas that we would expect programs are putting more money for mental health consultations, in there as well, and making sure that you can help internally your staff, your parents, kind of work through this dynamic, because this is a tough time. People are stressed out, and so we want to make sure where there's allowable costs and there's some flexibility that we've been given, that we can go ahead and meet the needs where they are. Someone mentioned, so are we getting, this is Capone, are we getting PPE funding, but our frontline grant staff, Head Start and CCP teaching staff are primarily paid through grants? Is it okay to pay the other staff through PPP funds following our established cost allocation? I don't see any reason why not. I think that you want to make sure that you're able to, to justify your grant funded staff. They're already 100% covered, and you're trying to make sure that the ones who aren't on the grant are also covered during this time frame, because they're also affected. I don't see any reason why not. So will Head Start help with funding PPE? We've been talking about that, and we want to help. We want to help. At this point, I can't make any promises, but that's something that we're going to be getting back to everybody with. The question is, will we force a center to reopen if they
Located in a zip code that is a hot spot? Julie, we're not talking about forcing anyone to reopen, but what we are saying is once the goal is out there, and that's why we want to be close and working with you and working with state and city, because at the end of the day, once we get the goal ahead to begin to open, our funders anticipate and expect that we are open. Again, that's why we're doing everything we can to think through. We're looking at hotspots, we're looking at all of that, looking at all kind of guidance and looking at protective measures, looking at risk values. We're trying to look at all of that, and that kind of guidance will come to all of you yes, we do have hotspots, and yes, those are concerns. But once we get the go-ahead, what they're asking is that we open at whatever level it is that we're talking about opening at. And Julie, you and I can talk offline a little bit more about your concerns with that. But once we get the go, that go goes to our federal funder, and it also, again, the go ahead would be coming from our governor, who has our ECBG block grant. So just know, and we can talk offline.
The question is, will we now need students to return back to reprogramming with medical clearances? Kimberly, thank you for asking the question. That's something that will also be floating through the committee as well.
And the question has already gone out there, because we know in this circumstance, we were saying they didn't have to have them up to date. But I know CDPH and IDPH has already going to be given information around the need for medicals and all of that. So again, when we're talking about giving you information, and I know we're being global in our thoughts here, but just trying to think through all of the different points. And so again, making sure that that one gets listed again, we'll take that one forward one more time.
Christina, you're posing a question about how will a group size of 10 affect our enrollment obligations. We hear you. We hear you. And, you know, that's, again, something that we're still trying to figure out. How can we make this work? You know, a big part of this, again, is making sure that we can get guidance and confirmation of what our funders are going to be willing to, you know, to accept. You know, could it possibly be that we have 10 in the center and maybe 10, you know, at home still learning? We don't know. And so we're still floating those things around, but we'll definitely let you know how it's going to impact your enrollment, but as well as the grantees' overall enrollment as well.
The other thing I just wanted to say as well is we have a DC office that communicates with the federal level of funding. And so as the states are making decisions, they're also going through that, and those individuals in DC are carrying the voice about what all kind of guidance and everything to help make some of the determinants that are being made in states work within the federal statutes and funding. So it's across varying levels that these discussions are happening, and I just want you to understand that it's not being lost on any of us when we're talking about a group size of 10 where we would normally have 17 or 20. And so those conversations have been lifted. Again, to Tiffany's point, it'll be about the guidance that comes back. Once all of this goes up, what comes back will give us the information on what then we will be sharing with you.
Kapong, you had a question about the use of cloth, reusable PPEs, I guess face masks that are sanitized daily, and wanting to know if that's allowable. I really encourage you and everyone, make sure that you're looking at CDPH's website, right? Because that's where we're getting our information from. And so take a look at their website and look at, you know, and see what they're recommending, right, at the various levels.
Will you be requiring parents? All of these things are going to be written into it, because the guidance will tell us exactly what information we need and for what reason and what purpose to ensure that families are safe, your families that you are serving are safe. And so let us get all of that guidance out to you, because it will say to you what you need to do and who you need to communicate with, and what your communication, for example, back to a family. When it comes to somebody who's been personally affected, I'm saying personally affected, there's multiple ways that could be, having been affected. I could have been in a space where somebody was. It could be someone in my house. Because that's open-ended, what I say, let's go with guidance that we give you to talk about what your responsibilities will be.
LaShanda had mentioned about will we be able to do children in the AM and then children in the PM. And currently we don't have any slots that are considered a half-day slot. So I think that that is something that we've talked about internally, but I guess one of the things I will throw back out there to you guys is, will that meet the needs of our families? You know, I'm going to let that sit there, and I'm not going to really answer that, because we have to know, is there even a need, right? Will families come if we're only offering a half day of programs? And I think that would be a great survey question. Says new classroom size will represent more space, more teachers. Are you going to support delegates with more funds?
Right now, what we're talking about is living within our current construct of funding. I'm not going to say that we have any additional dollars to do all of these things. And so, again, when it comes down to spacing groups of 10, it's looking at facilities, it's looking at your square footage, and again, one of the things that Tiffany said earlier to someone is start thinking about in your own facility, how might you be able to serve children, and looking at, you know, if we said that it has to be spaced out a little bit more, what might you be able to do in your environment?
Absolutely. And I mean, for the most of you have brick and mortar spaces. I mean, I don't know how you necessarily build on more square footage. I don't think that's going to be possible. I don't even think it's going to be reasonable. So let's think about maybe some strategies that we can working within the confines of the space that we have. Definitely not trying to go out and build new space.
Should we continue to try and recruit to fill our slots? We need people to continue to try to recruit. We need them to still have families. Again, what we've already said is some of the families may not return. And so if you stop thinking about recruitment and half of your families don't come back and you have some families who are interested in coming in, you want to know that you communicated with them. One of the things that you need to do is continue to communicate with your parents and letting them know that, you know, you will let them know when you might be opening. You'll let them know about what your new procedures will be. You'll let them know what the guidance is. But there are families that are out there who may be ready to come in and be served, whereas in some other cases, families are going to stay home because of loss of job and other impacts.
Yeah, and we have to be able to kind of see ourselves on the other side of this. And so forward thinking about how we plan for next year, we want to be hopeful that we're going to be able to have a rich and full program. We want to be planful in that way. We also want to be realistic with the fact that we don't know what the unknown holds. And so as we think about what we look like next year, we want and we need to be fully enrolled in our program. What does that look like? It may look different.
And I see the comment about a virtual town hall so that some of this communication can be had. I will lift that one up to say that that's what people, my delegates are asking for. So we will definitely take note of that one. Thank you.
Will child care in Illinois Phase 3 just be emergency child care licenses?
Right now, and currently we are where we are, and we still only have emergency child care. As soon as we have guidance on moving into what would be the next phase, then we'll come back to you. That's one of the reasons that we're trying to do these every couple of weeks, to give you updates on where we are so that you can see where the movement is in the state and the city, keeping you abreast of what's going on and what they're saying and what the thought pattern is about reopening.
Thank you, Andrew. We appreciate that regarding the trainings and workshops that focus on trauma. We'll get back with you.
The question about yes, there has been a request for emergency child care. There was a request that went out asking for emergency child care. We did get a lot of emergency child care response and have them across the state. What we do know is that the numbers of response, the rate of response wasn't as what was expected as far as the number of the utilization, shall I say, for emergency child care. And so before, I mean, if you want to reach out, there's a website that you can go to. You can contact Illinois Action for Children if you're thinking about doing it. If you are a PSA PI funded organization, you can do that if you're Head Start funded. It is a very huge complication for you to think about it, but the options are there. I can't tell you not to do it if it doesn't impact your funding.
Janelle, you wanted to know if there's going to be any advances given for the new fiscal year. No, there's not going to be any advances.
The CARES Act document needs to be completed by anyone who accessed it. For example, if the delegate received funding through the CARES Act, that delegate will reference what they got as a delegate. If you are a partner site and you did your own application and you got the CARES Act dollar, I need you to respond to that survey because that was an application for a loan that is specific to your organization. I hope that answers your question. If not, let me know, Matilda.
Lisa, you have a question that actually we've discussed internally quite a bit, and that's regarding qualified teachers not being able to return back to work when the center reopens, whether it's due to their lack of child care, camps, or just their overall safety concerns. Maybe they're going through some personal issues themselves. And so we understand that. That's one of the reasons why Rachel mentioned surveying, right? We want to go ahead and make sure that we're keeping our pulse on our staff as well as our families, because we want to be able to kind of get those rough estimates. You know, will they come? Will they come if we open our doors? And that's a real concern. That's a legitimate concern. And so I would just say, I mean, make sure that you're keeping in touch with your staff to know, you know, because you need to know if you're going to have the staff available or not, and how you can go ahead and strategize to get there.
And remember, our continuation of funding really was about to protect your workforce. What we knew was if the funding wasn't there, then had trying to get staff to come back after they had completely disconnected and were going through the issues of just trying to sustain their families, you would have a much harder time having them come back. But again, to your point, you do need to be reaching out, and yes, to what Tiffany just restated, is you need to be in touch with your families and your staff to find out what it is that might impact their ability to come back. Some of it might resolve itself in a couple of weeks when you get ready to open, if that's the date. But if you don't know and you don't have those kinds of communication, you do this great plan with the plan of opening and don't have enough staff to meet the needs for the families. And so you really need to be reaching out and finding out what's going on so that it can be a part of your planning tool for reopening your facility.
And the second part of Lisa's question is, will there be any exceptions for teacher qualifications? I want to encourage all of you guys, make sure that you're looking at our SELS 2.0 manual, because there is a section in there regarding waivers. Make sure you take a look at it, read it, okay? And if you have any questions after that, let us know. Does DFSS need to approve any new health and safety policies that a center will apply?
As far as our approving them, what I'm asking you to do is follow what we're going to give you. I want you to be thinking about it. You're business owners and you have policies and procedures regarding health and safety. What we're asking you to do is we're going to be giving you guidance is what edit might you need to make to it. For example, if you're thinking about the number of times to your staff, for example, let's go do with this one. Number of times that your staff who usually will come in to clean your facility. You're structuring a new change where you're getting that much more detailed work being done multiple more times in a day. You have to put that in your policy so that your staff understand you made a decision that you needed rooms or your facility cleaned more often. As a result of that, you're requiring them to do something more often during the day. They need to understand this. So my whole thing is making sure you understand when you're writing policies and procedures that the people who are implicated by those know you've written that into your policy or procedure. So it's making sure that anything that changes the staff work or requirement or what it is you're asking them to do, that is written into your policy. If you're saying to parents that there's something I'm going to do differently about your coming into the building or what you're doing during the day and all of those different things, just think it through. Those are going to be in your policy. Am I going to say that I need to sign off on it? What I am going to say to you is this. I need to know that your policies align with the health and safety standards that we're going to give you based on what we're saying about COVID-19. So once we get these procedures out there, the teams will be asked to repeat basically what I'm saying is, did you put these into your policies and procedures, and can you show us that these are done? Because we want to make sure across Chicago that we've thought through health and safety and we're able to keep children and staff and youth safe in the process.
Cindy, you want to know if families who need food assistance, can we use our budget to purchase? We know traditionally food was not allowable. So that's a good question. I think that we need to look at this as, I'm not going to give you a blanket answer. What I'm going to go ahead and do is allow you to think about the fact that if your center was open, right, what food would you have given, right, to your children during the time that they were in care? So one of the reasons why we have said that things like formula is something that would be allowable is because there were maybe an 8-hour stretch of the day in which those children kind of relied on the formula coming from your center. And in those instances, we want to be able to still help families be able to make sure that they're getting the formula to their children that they need. I think that what this is not and what it shouldn't turn into is that we're buying groceries to go ahead and house a family and to go ahead and sustain. Instead, what we're asking for you to do is tap into your social services to go ahead and indicate those places where families can go who need additional food assistance. There's a lot of places out there, Chicago Food Depository among others, Chicago Public School as well, who are daily providing meals to families. And so that should be an outlet, not your budget that you have. Do we expect that we can reopen mid-June or July?
That's open-ended, and we're not at a point where we can give you any clarity on that. We're working it through. That's why we're still having meetings a couple of weeks, and so the next webinar is scheduled for the 28th. Things are moving really, really fast, and so we will be back with you to give you an update. If something moves even faster, you will get a notification that we need to meet with you before the 28th. So know that if things are moving fast, we are going to be communicating with you to let you know what we are projecting as far as dates so that you can be more planful on your side. So just keep receiving alerts, knowing when things are happening, and please continue to participate as you have been.
Will employers require a test prior to opening up?
And when you say test, if you're talking about COVID-19 test, whether or not people are positive, that's something that the guidance would have to come from the federal government, from the state, because that's not something, number one, that we have access to, nor can we require. It is something that has been brought up. People want to know. But right now, there are statutes that in some cases keep us from being able to do that. CDPH, IDPH, they're involved in these conversations. And so whatever guidance comes, believe me, we're going to share that with you. But again, if we say something, we have to be able to do what it is that we're talking about. In a conversation, for example, one of the things that we also recognize with, we give someone a test, that doesn't mean that they won't catch COVID-19. And so we have to wear the information and try to figure out what's the best guidance that can be given, and know that that's what's happening at both levels as discussions are happening around what we need to be doing in order to reopen.
Kim, your question is really long. I guess it's a lot of questions kind of in one around what you're doing with your family engagement and how you're entering information in Copa. What I would say is make sure that you're connecting with the supervisor of the team that your agency is on, so that those specific questions regarding Copa, that we can address them there. Someone wanted to know, I think this is Will, if we have unused PFA, PI money at the contract end and those programs are not extended into the new year, can we use the unused monies to pay employees past June 30th contract date? No, you cannot. And one of the things I want to, so Will, you and I need to talk. I need you to send me an email, because if you're already projecting that you're going to have unspent funds, I'm going to ask you why. You know, I want to know why, and I want to know what are you doing to go ahead and make sure that you're repurposing, right, and meeting needs of families kind of in this environment that we're in. I need to know what salvage you're anticipating, and you know, and why. Because at this point, you still have time to go ahead and do a budget modification to go ahead and move dollars around to where they may be needed. And so I really need to know a little bit more about why. Underspend right now, you guys, I know that this is a very tough time for us all, but we really do need to be mindful of making sure that we're meeting the needs of our families. And so are we doing enough, you know, at this point, mid-May, to say that I know I'm going to have an underspend? Are we doing enough is the question I'm going to ask. So we'll make sure that you go ahead and send me an email, and you and I need to talk.
Michelle, I see your question. As far as the group sizes, what we're saying is we're going to give you guidance on what, when we reopen the first stage of it, what it looks like, what the group size is, and what the needs of staff. The reason that we're saying 2 is at some point that teacher's going to need to leave out of the room. And you can't have a group of children left alone by that one person having to exit the room. So again, we have to think about safety. We have to think about staff-child ratios, and so all of those kinds of things taken into account. I know one of the things, for example, is if we're saying 2 teachers in a group, I would normally have 2 to 20. Where do my other 2 come from? Again, we're going to be talking to you about how you construct all of this, because we know that those are some of the things that you're thinking about.
It says, are you requiring everyone to apply for PPP? No, we're not. We're not requiring you to.
We're going to take just a couple of more, see what's different from what we've already responded to.
Someone mentioned about waivers in the Office of Head Start. So one of the things that we know that we're kind of going into this COLA application, and we're not going to be asking you to identify any non-federal match as we move forward with the application, because we've outright asked for a waiver of non-federal match. And so if there's an opportunity for us to ask for any additional waivers, we'll definitely let you guys know.
So the guidance that's coming out is for all child care centers in the state of Illinois, and that's one of the pieces in trying to write this guidance. Is not just about federal funded programs, not just about state funded programs. We have family, friend, and neighbor care. We've got family child care homes. We've got multiple places in the state of Illinois. So understand what we're talking about when we're looking at this is across the entire state of Illinois, across all of those methods that child care is being provided. But having people at the table from your group, for example, of delegates that we fund, leverages the ability for them to talk about the kinds of things that are being done in federally funded and state funded programs.
Thank you, Christina. Thank you. A lot of people are asking about waivers, Make sure that you're reading, those resources that Teresa had put, up there. We want you to go ahead and kind of know what's already being put out there in terms of waivers. If there's going to be any additional waivers, we'll definitely let you know. Go back down.
There's a question about how do you distinguish between the staff that you're paying for your PPP and the funding that we've given you. That's one of the really important things that you do internally within your house, is figure out how did you pay your staff and what funding source did you use. I can't, I really can't from this end, Tiffany nor I can help you figure that out, but that is something that you need to be looking at, because again, as I mentioned earlier, those funding streams are crossing over each other.
All right, we're going to take one more question, and
And so to the question about minimizing the number of people coming into facilities, yes, those are conversations that are happening, because in order to minimize risk, you have to think about how you keep down the number of people that might be in your environment, and then the number of people that might be in any classroom or group. So yes, those are kinds of discussions that are being had in the conversations that we are currently having about our programs and what we might be able to do going forward. So just know that yes, group sizes is a part of it. Containing risk is the overarching piece of this, and how do we do that? It's in thinking about from who enters the door, if they're coming in to do work, we need to know all of that, and your thought pattern has to be there for your facility. But it really, I just want you to remember, this is really about mitigation. This is about keeping environments safe. And yes, we are and have talked about limiting the number of people who have access coming into your building, and definitely into your groups or your care spaces where your children are. And so again, I want to thank everybody for spending time with us. We tried to go through as many questions. There were some that were duplicated amongst all of you, so we kind of hit on some of the others. I did see one question. If you did not apply for the CARES Act, your answer is a simple no. Still need you to say the agency name. It's a no, and then you can move through the survey very quickly. But again, I just want to remind everyone that there's a lot of conversations that are still going on. We will be bringing back information to you as it comes to us. Please look at your alerts, your CSD update, and others. Right now, we do have our next webinar planned for the 28th. If something changes very quickly next week and we need to convene again, you will get another notification regarding another webinar, because again, we want to keep you involved and engaged in understanding what's moving in community around reopening childcare. I'm hoping everybody is staying safe, doing everything that you can to keep your families safe, that you're communicating with your staff consistently, that you're consistently communicating with your families, that you are doing everything that you can to protect, and protect. And with that, I just want to say again, thanks everyone, and we will be in touch very soon. Take care. Have a great rest of your day.